Hello, my name is Gracia Sanchez and I'm going to talk about Valganciclovir for Symptomatic Congenital Cytomegalovirus disease. Definition: Cytomegalovirus is the most common cause of congenital infections and non-genetic censorship, hearing loss in childhood. Up to 2% of neonates, with the highest percentages found in developed countries, are congenitally infected with CMV. Approximately 10% have signs and symptoms of the disease, and 40 to 60% of symptomatic neonates will later develop permanent neurological sequelae. Congenital CMV disease with one or more central nervous system disorders, microcephaly, hydrocephalus, or ventricular enlargement, paraventricular calcification, cortical hypoplasia, or white matter injury, retinal choroiditis, and abnormal auditory brainstem response. The progressive increase in knowledge on the ways in which the host immune system and CMV relate has made it possible to clarify that the development of a vaccine that is certainly capable of reducing the risk of CCMV infection and preventing both primary and non-primary infections is extremely difficult. Early detection, intervention, and monitoring are important in mitigating the impact of permanent childhood hearing loss.
Hello Dr. Adam, how are you?
Hello Dr. Laura, I am fine.
I want to ask you about congenital cytomegalovirus infection.
According to clinical manifestations of congenital cytomegalovirus infection, there's two presentations. The first presentation is early presented with acute fulminant infection involving multiple organs like petechia, jaundice, hepatosplenomegaly.
And the second presentation?
The second presentation is early presented without life-threatening complications with microcoli and intracranial calcifications, especially periventricular. Sensory neural hearing loss is the most common sequela after the two presentations.
What's the investigations I should do to diagnose congenital cytomegalovirus infection?
Viral cultures in body fluids, oral secretions of urine in the first 3 weeks of life. After 3 weeks, the infant may have acquired the organism at the time of delivery or postnatally via breast milk. Test quarter infant's blood for cytomegalovirus detection by PCR. Cytomegalovirus, immunoglobulin G, and immunoglobulin M are a limited usefulness. But negative titers in maternal and infant sera are sufficient to exclude congenital cytomegalovirus. Long-term follow-up tests include serial audiology and developmental assessment. Head circumference and ophthalmology should be done to any infant with congenital cytomegalovirus infection.
And how I can manage that case?
In asymptomatic congenital cytomegalovirus infection, treatment is not indicated. According to symptomatic infants, Valganciclovir is indicated for cytomegalovirus retinitis, colitis, meningoencephalitis, esophagitis, hepatitis, and pneumonitis. Valganciclovir is given at a dose of 10 to 15 mg per kilogram per day IV infusion over greater than 1 hour, divided every 12 hours for 3 to 6 weeks. The use of cytomegalovirus microimmunoglobulin has not been evaluated extensively for the treatment of congenital cytomegalovirus disease.
Okay, thank you Dr. Adam.
You're welcome.
Application in medicine. Valganciclovir is used for treatment of neonates with CCMV case, also for infections in people with AIDS. Valganciclovir is the final product that is metabolized by your bodies. Some clinical trials have shown that oral Valganciclovir can improve hearing and neurodevelopmental impairment in infants with congenital CMV disease. Therapy. Valganciclovir is administered by intravenously therapy or oral on patients from 6 months. The administration of 16 mg per kilogram of VGCV twice daily for 6 months. It could take months to see improvements. However, VGCV has neither been approved in Japan nor other countries as treatment for this disease by the government health insurance.
Hello, welcome to another telehealth information video. My name is Garfield. Today's video is on Valganciclovir. Valganciclovir is used to treat cytomegalovirus infections affecting the eyes with AIDS, as well as preventing cytomegalovirus infection in people who have had organ transplant from a cytomegalovirus positive donor. Valganciclovir contains the active ingredient Valganciclovir. Valganciclovir is known as a prodrug. Once inside the body, it is broken down into the active ingredient ganciclovir, which is an antiviral medicine used to treat infections with the cytomegalovirus. Ganciclovir works by blocking the action of a viral enzyme needed for the virus to replicate itself. This stops the virus from multiplying, which controls infection and helps the immune system to deal with it. Valganciclovir tablets and oral solutions should preferably be taken with or just after food or a meal. The dose prescribed and how often to take the medicine depends on the condition treated. It is important to follow the instructions given by your doctor. These will also be printed on the dispensing label that your pharmacist has put on the packet of medicine for you. You should take the tablets at regular intervals and always complete the course prescribed, even if you think the infection is cleared up. Valganciclovir should be used in caution in pregnant and breastfeeding women, and only if the expected benefit outweighs the risk to the baby. If you're pregnant or breastfeeding, make sure to consult with your doctor on the safety of taking Valganciclovir. Valganciclovir may cause dizziness, so it is advised that you abstain from driving or operating heavy machinery until you know how Valganciclovir affects you. It is best to avoid drinking alcohol, since the combination could increase the dizzying effect Valganciclovir may have. Make sure to tell your doctor what other medicines you're taking, as they may have undesired interactions with Valganciclovir, especially medicines such as certain antibiotics and antifungals. Some common side effects of Valganciclovir include fever, diarrhea, dizziness and headache. For a complete list of the side effects, go to my website www.lynchespharmacy.com.
Pros and cons. Pros: decreases the progressive hearing loss. Used to prevent cytomegalovirus disease in people who have received heart, kidney, or kidney pancreas transplant. Improvement of thrombocytopenia, liver function disorder, and retinitis. Cons: could produce diarrhea, vomiting, constipation, fever, infections on upper respiratory tract, and hypertension. People with kidney problems could have an increase in both mycophenolate, mofetil, and ganciclovir concentrations when both drugs are taken together.
So to build these models, you have to make a lot of assumptions, and we base this on data as much as possible. In fact, it was all based on data of varying quality, but we assumed that 1.5% of all newborns would fail the hearing screen, and this is based on U.S. national data for early hearing disability intervention programs. And of these, about 10% will actually have true sensorineural hearing loss based on a diagnostic test. And then we proposed screening with a saliva swab for PCR testing. Again, with the idea that at least now we don't have great data that dry blood spot testing would be sensitive enough, and we know that the saliva swab from the CHIME study is about 97% sensitive or so, and 99% specific. And we chose a prevalence of congenital CMV infection at birth to be 0.5%, again based on the CHIME study, and which is consistent with other population-based studies. And we generously assumed that clinicians would identify symptomatic congenital CMV 25% of the time, which is the highest proportion that's been reported in the literature. And then this is important that we were able to use very detailed data about the timing and severity of onset of symptomatic sensorineural hearing loss in congenitally infected kids identified universal screening using cohort data from the University of Alabama to be able to figure out how much earlier, for example, we would identify late onset hearing loss in what proportion of kids and how severe. And
issue applied in Ecuador. At the university and research repository of the country, there are non-exact numbers of cases of congenital cytomegalovirus. There are incidence studies, diagnosis in pregnancy, and treatment guide. Conclusion. Cytomegalovirus is a genus of viruses in the order Herpesvirales, in the family Herpesviridae, in the subfamily Beta Herpesvirinae. Humans and monkeys serve as natural hosts, but 10% have signs and symptoms of the disease of CCMV, and 40 to 60% of symptomatic neonates will later develop permanent neurological sequelae. And for treatment, it's usual take oral Valganciclovir can improve hearing and neurodevelopmental. Unfortunately, there are no studies in the country to review how the disease is monitored. Thank you.